If your MRI or X-ray is showing you have Lstv or Lumbo-Sacral transitional vertebra, what does that mean? Sometimes it is also called as Bartolotti syndrome, and it is mentioned by this name in your MRI or X-ray report. So come, let's understand it on a model. This is the front view of our vertebral column. Normally, all these bones are totally free of each other so that they can move comfortably. In case of Lstv or Bartolotti syndrome, sometimes what happens, this transverse process or this bone here, it is elongated and it fuses with this bone here. So as a result, these two bones are not free. They are fused at one point or maybe at more points. Now there are 4 types of classification as per the Castelvi classification for this problem. Sometimes it is just the elongation of this bony prominence here. Sometimes this bony prominence elongates as well as it fuses with this bony prominence here. So these two bones, they become one. Similarly, sometimes there is not a perfect fusion but a pseudo fusion, that is, not a proper bone is formed but a painful bone is formed. And lastly, sometimes there is a proper fusion on one side and there is a partial fusion on the other side. Normally, this Lstv syndrome or Bartolotti syndrome starts giving pain around the age of 30 years of age. It is more common in males as compared to females, and it is present in 18% of normal population. Though it is present since birth, but it starts giving pain around the age of 30 years. So if your X-ray or MRI is showing this problem, your symptoms might be just back pain or pain radiating down the nerve. Sometimes when this fusion is too strong or too broad, there is hardly any space for this nerve. So this nerve gets pinched here and it starts giving pain in the leg. So initially the treatment is through medicines, exercises, rest. We strongly advocate physiotherapy in this case because exercises will keep you healthy for a longer period. Also, you should try to reduce your weight and avoid forward bending activities. If there is no improvement with conservative treatment, then only we give injections at these pain points to reduce the patient's pain. These injections are given under X-ray vision in operation theatre. If everything fails, then only fusion surgery is required depending on the degeneration. If degeneration is at this level, fusion might be required. It can be through LIF or TLIF, whatever the choice your surgeon makes. Or if these two segments are completely fused, then degeneration might happen here. In that case, we need to fuse this segment using TLIF or ALIF or whatever surgery is required. Thank you.